Paging Nurse Harold, please perform the physical examination of the patient in room 101 for the assessment of the eyes, ears, nose, and mouth.
Prepare all the equipment needed. Perform hand washing. Provide privacy for the patient.
Good day, ma'am. I'm Harold Marie Taruk, and I'm staff nurse in this hospital. So, may I know your name po?
Ronald,
How about your age?
17,
How about your birthday po?
May 27,
Okay, may I check? Okay, that's good. So, for today, I will be performing the physical examination, particularly in assessing the eyes, ears, nose, and mouth. So, is it okay to you if I will touch those parts?
Yes.
Okay, shall we start? Okay. First is I will be doing the eye assessment. So I'm gonna check how good or how clear your eyesight is. Of course, I will check if there's a certain spot or angles at which you might have trouble of seeing. So of course, during the assessment, I might need to ask you something, to read something, and I will focus to you the light using my pen light. So is it okay to you if I will do that?
Yes.
Okay. So may I ask you if do you have any history of eye diseases, any symptoms or surgery?
None.
How about family history of diabetes? Do you have?
None.
Do you have any surgery or symptoms of eye problems?
None.
How about do you use eyeglasses or contact lenses?
No.
Okay, good.
Don't forget to wear the gloves.
Next is I will inspect and palpate your eye accessory structure, the tenderness, the symmetry, and the lid margin. And I will observe for secretion, the erythema, and also the position of the lashes. So, is it okay if I will touch your face?
Yes.
Okay. So the patient's eyelashes and the eyebrows are evenly distributed both on the left and the right side. Both are symmetrically aligned. May I touch your face again?
Yes.
Okay. So the patient's eyelids are symmetrical. Eyelids are in contact with eyeball. And there are no lesions both on the left and the right side. So, ma'am, could you close your eyes tightly and open them up for me? Open them up. So, the patient has no trouble of opening and closing both on the left and the right side. Eyelids are covering of the part of the sclera, which is normal. So next is I will inspect the color of the conjunctiva, the sclerae, and the iris. So, ma'am, is it okay if I will touch it again your face?
Yes.
Okay. Look up. Okay. Look down. So the patient's conjunctiva is pinkish in color, which is normal. The sclera looks perfectly normal. And the color of the iris is in dark brown color. And the size is normal. Now we're gonna proceed to checking the constriction and accommodation of the patient's pupils. So I've dimmed the light. And ma'am, I want you to focus on that object right there. And I'm using the pen light and I will focus to you the light. And I want you to focus on that for a moment. So is it okay, ma'am?
Yes.
Okay. So both on the left and the right side of the pupils are constricting as it should, and it's normal. Both are responsive to the light and it has an accommodation. The size, the shape, and the symmetry are normal. Now I'm gonna test the visual acuity of the patient. So ma'am, I have here a piece of newspaper and I want you to read it with covering and without covering of your both of the left and the right side. So let's start. Okay. With covering of your left eyes,
Living heroes.
without covering,
The heritage.
with covering of your right side of the eye.
Living heroes.
How about covering?
The heritage.
Okay, that's so the patients can identify and read the newspaper properly in doing the cover and uncover test. Now we will be performing the functional visual test by assessing the 6 ocular movements. I want you to do is to look at this pen light and don't move your head, and you just use your eyes to watch where I can move this pen light. Is it okay, ma'am? Okay, let's start. So focus on pen light only. Okay. So her eyes is constricting and it seemed to be normal. Next one is I will be doing the ear assessment. So the purpose of this assessment is to inspect the external ear canal, the tympanic membrane, and also to determine if there are some abnormalities of the ears. So I will inspect the color, the symmetry, size and position of the auricles and the tympanic membrane, as well as if there are some discharges, impacted cerumen, and if there are inflammation in the external. Can I touch your ears? Okay. Other side po. So, the patient's ears are seem to be normal, symmetrically aligned, and the size is also normal, both on the left and the right side. Second po.
Yes.
Okay. So, do you feel any pain if I will be pulling it? Okay. How about this? Do you feel any pain? Okay. So, the patient's ear canal are same with the color of the ear. There are no presence of the foreign bodies. There is cerumen of wax, which is totally normal both on the left and the right side. Next is I'm gonna palpate the pinna of the patient. So, is it okay if I will touch it again? Okay. So, do you feel any pain as I touch it? How about this? So, there are no swelling of the pinna, both on the left and the right side, and the patients have no pain. So now, I'm going to assess the gross hearing acuity test. So, what I'm going to do, ma'am, is I will whisper 2 words on these ears, both on the left and the right side. So, you need to tell me what I said, okay? So, you need to repeat what I said, okay?
Top notch.
Okay, so as you can see, she hear what I've said, so the nerve is intact. So now, I'm gonna assess the nose of the patient. So the purpose of this assessment is to assess the function, airway resistance, and occasionally sense of smell. Face, ma'am. Okay. So may I touch your nose po?
Inspect for any deviation in shape, size, and color, and flaring or discharges from the nares.
So as you can see, there are no discharge and flaring from the nails. So the nose is midline to the face. So next is I'm going to palpate for the external nodes. Any areas of tenderness, masses, and displacement of bone. and cartilage. Okay. Okay. So, ma'am, may I touch your nose po? So, do you feel any pain, ma'am? So, there are no tenderness of pain, masses, and displacement of bone and cartilage. So now, we're going to proceed to the mouth assessment. So at this point, you might need to wear face mask or eye shield so you don't get any mucus on the face. And if the patient is coughing or sneezing, the purpose of this is to determine the some abnormalities of the mouth and have a baseline data for underlying condition. Inspect the lips. May I touch your lips po? Okay. So the patient's lips are symmetrical both on the left and the right side. There is no lesion, no edema, no bleeding, and no some abnormalities. So may I touch your lips po? So the color of the patient's lips is pink and moist. It is soft and smooth. Now we're gonna proceed on checking the patient's teeth. So ma'am, can you smile for me? Could you open your mouth? Okay, I will check it out. So there are 28 teeth, and then there is normal for their age, and there is no retraction. So now, we will inspect the inside of the mouth. So here, we need a tongue depressor for that. So ma'am, could you please open your mouth for me po? So I'm gonna look inside of the cheek. If it is nice and pink, so I don't see any sores, and there is no lesion. So ma'am, could you please stick out your tongue for me? So the tongue should be moist like this and pink in color. Then I want you to lift your tongue for me. So I will look for any lesion underneath the tongue. So now we're going to test the glossopharyngeal knife. So ma'am, could you please say ah?
Ah.
So the patient's uvula is fleshy, solid structure that hangs freely in the midline, no redness, and no oxidant from soft palate. Next is I'm going to palpate for the cervical nodes and salivary glands for enlargement and tenderness. So could you please open your mouth for me, ma'am, and lift up your tongue? Can I touch it? Okay. So there are no enlargement and non-tender, and all are normal. Thank you.
After that, remove the gloves. Perform hand washing, then document all gathered data.
Ma'am, in assessing your eyes, ears, nose, and mouth, I don't see any abnormalities and all are normal. So thank you for participating.
She's a Mona Lisa. Everyone's lining up to see her.